context element, and then there's also the frontal lobe element, and that thinking of creating new habits, creating new values, creating less triggers in your life. That's the opportunity that we all have, and I think that's the project you're working on. What's the stuff we can control without zapping ourselves and without putting pills in us? Those things set the boundaries, but the frontal lobe regulation of how we feel is in your own command. And you've seen it in Buddhist monks. You've seen the mind-body connection in deep divers. There's actually two nerves that come down and wrap around the heart. They can think down their pulse. They can think down how fast their heart beats. This is not like baloney. This is, you can put an ultrasound, you can look it up online, you see videos of it. That shows that thinking can change, thought can change how fast your heart beats. Why wouldn't we believe that thought can change those subcortical structures about anxiety and depression? If you get depressed, you're sort of, you can get stuck. But people who aren't having those mental health issues, but just want to be better and live a more rich life in the sense of personal experience, we can think about our lives and our habits and triggers and create effects inside us. The mind-body connection is mind down to body. And many people feel, body back up to mind, and that's where meditation and meditative breathing come in. But those connections are real. You see examples around you. If your frontal lobe can only help you 5% and somebody else is all dialed in and helps them 50%, it doesn't matter. That's your best. And that's an avenue available to you. But it's not a simple one. It's not a quick fix. It's not gonna be a bullet. It actually takes work. And you mentioned repetition. It takes work, it takes effort. And there is no shortcut to it, but it's a glacial change that can happen over a few months to a few years. And I think once, like people who go to the gym, they can't not go to the gym anymore. I think people who find these rituals and habits that make them feel better, they become addicted to that, and they're constructive and they're not pharmacological.